All right, so this is going to finish up. All right, so this is going to finish up week 3 of the pharmacy technician course. We left off on the last video about theft and diversion of drugs. This basically walks through and explains, what robbery is, what burglary is, shoplifting, internal theft, all things that you're going to need to know in order to keep the place that you're working safe. So you know what is what and the protocols when the employer asks for it. This isn't going to be so much. I wouldn't say this is going to be on the pharmacy technician exam, but this is going to be good to know for you to fully be able to perform your pharmaceutical technician duties. So, quality assurance and control. All right, so the purpose of quality assurance and control, testing to be sure that the products provided are what we say they are, as well as double checking our work, is vital to providing safe products to patients and customers. An understanding of what can possibly occur helps the technician to learn what to look for in preventing errors as well as catching them before they can potentially cause harm. So, this last thing that says potentially cause harm, that's basically one of our most important things that we do is to make sure that whatever we're doing provides safety for the patients. So I'm gonna go ahead and underline that. Yeah, so common error types. You'd be surprised how often mistakes actually happen within a pharmacy, or maybe you wouldn't be surprised, but they actually happen quite often. There is a place that I know of that is a mail order pharmacy, and there's tons of mistakes that happen, whether it's going to be data entry, someone input something wrong, and that actually gets sent out to the member, or something like that. But it does happen often, and so there are definitely safeguards to keep those from happening. But as this list says, the common error types are going to be all prescription errors fall into one or more of these categories: incorrect interpretation of the prescription, incorrect entry of the order into the computer, incorrect medication picked from inventory, incorrect amount of medication placed in container, incorrect label attached to product, incomplete or improper auxiliary labels, and prescription given to the wrong patient. So, incorrect interpretation of the prescription. What are some of the things that you could think that that's going to be used for? Incorrect interpretation of the prescription. Maybe you read something incorrectly. Maybe we all know how great the doctor's handwriting is, and so that we need to make sure that if we're not 100% sure, we need to check with the pharmacist, or we need to make an outreach to the doctor's office for clarification. And go ahead, and if you have any experiences of any of these below in your place, maybe you have a story or something, go ahead and put it in the comments below, and I'll go ahead and point those out next video that I make. So another common error type is incorrect entry of the order into the computer. That's something we kind of already talked about. Incorrect medication picked from the inventory. So that's why it's so important to have the right stuff at the right places. And so when you go and you go to the lisinopril spot, bang, it's right there. You don't have to hesitate and pause, but you know exactly what it is, and where to get it from. Incorrect amount of medication placed in container. That actually happens a lot too. There's automated systems that actually count the tablets, but those still are checked. But there are a lot of times where maybe a tablet misses the bottle and it falls on the floor or things like that. So we need to make sure that normally it's a pharmacist's job to double check, but we might fill it, but they can double check it. Incorrect label attached to the product. That just speaks for itself, as well as incomplete and improper auxiliary labels. Now, go ahead and ask yourself if you know what an auxiliary label is. I mean, do you know what it is? Go ahead and talk to the computer, pretend like I'm listening. But an auxiliary label is going to be one of those add-ons to the bottle that are going to help warn the member what to do, what not to do. Maybe some of it's going to be drink with milk, drink with water, eat, don't drive while you're on this medication, tons of those kind of things. So the next one is prescription given to the wrong patient. Now that's another big one, very important one, because if you give the prescription to the wrong patient, then they might be taking the wrong medication, or maybe they're not going to get their medication. So it's all very important that we make sure that the right medication goes to the right patient every time. All right, so quality control of solid oral dosage forms. These are the checks typically done in the retail pharmacies on every prescription. It is checked visually by a pharmacist against stock, and auxiliary labels are checked for accuracy. So that's kind of just something that we talked a little bit about before. Quality control of injectable and compounded medications. These are done less frequently, sometimes only on a small sample of prepared medications, and usually in hospital settings. Usually required expensive or time-consuming analysis of materials, since they cannot be visually distinguished or measured. So, you're going to have a cream. You're not going to test the full batch of the cream that you've made, or the lotion or the ointment, but maybe and you won't be doing this, so you don't have to worry about that. But it's good to know so you understand what's kind of going on at the pharmacy. But it is checked by the pharmacist, and they'll maybe just take a small sample, test for proper ingredients, make sure that it has the right strength, those kind of things. Proper procedures followed to avoid contamination or calculation errors. A lot of compounds, majority of the compounds should be done in hoods to keep it sterile, and that's going to help avoid contamination. All right, so fitting into your workplace. Everybody wants to fit in. Everybody wants to not screw up or do something that they're not supposed to be doing, but they want to make sure that they're doing a good job. Everyone likes the praise. But being a successful technician means also being a successful worker. To do this, the technician needs to understand his or her role in the pharmacy, complete assigned tasks successfully, and contribute to overall company goals. All right, automation. I think I previously mentioned that just a few slides ago. But to help ease the burden of pharmacists or technician staff shortages and increasing prescription volume, automation has been employed in many ways. Pharmacy computer systems serve as a database collectors for RX labels, prescriptions, serial numbers, warning labels, patient profiles, and many other entries. Softwares can alert for drug interactions, allergies of patients, high doses, etc. Pharmacies can even link their databases, given their patients greater flexibility in filling location. Inventory applications are also used, facilitating the ordering, restock system, and track of drug usage amounts. So it's way cool what the technology does and how it makes our job easier. However, we're not going to have to worry about robots taking over our jobs, because it's definitely always going to have to be humanly done or physically done. So you want to make sure that you understand. It also would be good to kind of know how the machines work. So if something does happen, you might be the go-to person. But it's definitely, a lot of machines are making the prescription labels all by itself. All right. Oh, this is what I just talked about as well. Counting machines may be used, although Schedule 2 medications, and in some cases 3 and 4 and 5, also must be hand counted. All right, so that's also something also very important. Control medications are never machine counted. They're always counted by a pharmacist and always checked. The Kirby Lester Company is the main producer of such machines. Barcoding has many applications, from inventory management to actually dosing patients in hospital drugs. Machines and robotics have been employed in the dispensing of drugs. Baker cells and cassettes are the most common type of containers and dispensing units. While robotic types include ScriptPro and PharmaCare, in hospital settings, the most common type of automated dispensing system are the Psychics and Omnicell systems, which employ a system of drawers and compartments managed through a compartment system with the password protected. As the number of prescriptions increases with an increasingly aging population, pharmacy technicians will be more involved with different technologies in order to manage the workload of healthcare. So it's good to have a general idea of, of automation, fitting into your workplace. Well, fitting into your workplace is important, but automation, I wouldn't say is going to be essential for the exam. I don't think it's really going to be on there at this point. So, but it would be good to know in order to, like this says, fit into your workplace. All right, so now we're going to go on to the drugs. And this is going to be on page 122 of those who are in the online technician course. So you can go to page 122 in the workbook or in the work manual, and it'll talk more about antianginals and give you actual specific medications. So angina pectoris is a characteristic chest pain caused by a coronary blood flow that is insufficient to meet oxygen demands of the heart muscle. Angina is characterized by sudden severe substernal pain. Now antianginals. So angina pectoris. So pectoris, when you think of pectoris, there's a muscle. It's called the pectoral muscle. That's going to be your pectorals. Sometimes they may be referred to as pecs, or basically your chest area. So if you know, like, your muscles, pectoris is going to be your chest muscles, and angina is going to be pain. So antianginals or anginals or whatever, however you want to say it, it's going to be anti, so not pain in the chest. So there are at least 3 classes of drugs used in the treatment of angina. One is the calcium channel blockers. 2 is the beta blockers. And 3 is the organic nitrates. Now, real quick, the first thing that comes to my mind when I think of organic nitrates is I think of nitroglycerin. Nitroglycerin. And nitroglycerin, is whenever you're having a heart attack. We've talked about it in previous videos about the non-safety caps, how nitroglycerin, they don't have the safety caps on there, because if you're having a heart attack, you need to be able to pop a cap off, take the medication that you need it before anything happens. Let me go ahead. I want to check to see if there's any comments so far. So just a moment, please. Oh, well, thank you, Yata. I appreciate your gratefulness of the videos. All right, so organic nitrates. Organic nitrates increase blood flow in the cardiac muscles by relaxing coronary arteries. Antiarrhythmics. Now, the way that you remember that is arrhythmic. If you have any musical knowledge at all, arrhythmic is like a rhythm. So if you think of a rhythm, you think of a beat. So like a boom, 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 boom. And what makes that sound? Your heart makes that sound. So this is going to be something that has to do with the heart. So the heart contains specialized cells which regulate the heartbeat. Dysfunction of the cells or electrical conduction at any number of sites in the heart can cause bradycardia or tachycardia. And there are 5 classes of antiarrhythmics. Medications, of course. So one's going to be your sodium channel blockers. One's going to be your beta blockers. Class 2 is your beta blockers. Class 3 is the potassium channel blockers. Class 4 is calcium channel blockers. Class 5 is miscellaneous, so other ones that aren't mentioned. Um, kind of going back again to the test, it's going to be important to know what the antiarrhythmic means and what it is. And it's going to be helpful to know what those 5 can do to help. So, all right, now we're on to the math. This is exciting. Oh my goodness, I hope you're as excited as I am. Ah! So, all right. So percentages and concentrations. Now this, if you've been following the other videos, this is just going to be just like I set up everything else. So percentage, this is expressed as parts per 100. For example, 50% is 50 parts of 100. There are 3 ways to express a percentage. One is a fraction, so 50 over 100. A decimal, 0.50, or ratio, 50 to 100. So for example, a question might say, if you get 670 points on your exam out of 900, what is your percentage score on the exam? Well, this is really, you could probably figure out how to do this, but like I said, I'm consistent in how I do things, and so I'm just going to go ahead and do it. It's always good to write it down. Don't ever try to do something in your head, because that's where mistakes are made and that's where you get messed up. And it's those stupid small mistakes that could make the difference between a passing and failing. So you get 670 points out of a 900-point exam. So the 900-point exam is the full exam. That's the total amount of points that you can get. So that's going to be your 100%. All right. You're going to want to know what percentage is 670%. So if you do the line equals line, and then your known values and your unknown values, you cross multiply and divide, and that will give you the answer. And what the answer is, I don't have my calculator, but let me go ahead and try something real quick. I'm not going to do it in my head because that would be bad, but it's going to be 670 times 100 divided by 900. That's going to be a 74%. So you got a 74%, which is passing. So yay, you passed the exam. Woohoo! All right, so now concentration. This is a percentage expression, the physical nature of a solution, solids, or liquids. There are 3 different types of concentration. Now this part is very, 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 very important. I would make sure that you know this front to back to front, up and down, left to right, right to left, down and up. So the first is weight to weight. The parts are grams per grams. This is typically used for percentage strength creams, gels, and ointments, and appears in compounding problems throughout the PTCB exam. So for example, you have a 10% cream. So the 10% cream is going to be 10 grams over 100 grams. Now, whenever you see this, what it's reading is it's saying that there's 10 grams of active ingredient or active drug per the 100 grams of product. So if you I don't know, if you make Kool-Aid, or if you make orange juice, or if you make, I don't know, cleaning materials, if you put 1 teaspoon, let's say you put 1 teaspoon of weed killer into 1 gallon of water, well, first we see that there's 2 different units, right? We see that there's a teaspoon units and that there's a gallon units, but we want the units to be the exact same units. So I don't know how many teaspoons are in a gallon, I'm sorry, but I do know how many milliliters are in a teaspoon. And there's 5 milliliters in 1 teaspoon, and there is 5,640 milliliters in a gallon. Sorry, I'm wrong. Let's rewind that. There is 3,785 milliliters in a gallon. I don't know where I got that other number from. Huh. All right. I'll have to look at that after the video. So what this is going to say is our concentration is going to be 5 milliliters per 375 milliliters of water. Well, let's go ahead and add water here. All right. So what this is saying is that the 1 teaspoon or the 5 milliliters of active ingredient for the 1 gallon of water. So if you want to know the percentage, you would just go 3,785 divided by the 5. False. You go the 5 divided by the 3,785. That'll give you 0.0013%. So very, very small percentage. All right, the next one is going to be volume to volume. The parts are milliliters per milliliter. So this is used to represent liquids preparations such as solutions and elixirs and their active constituents. So 10% of a solution, basically the exact same thing. 10 milliliters of active ingredient per 100 milliliters of product. All right, now this, sorry. Now this is going to be important to know. This is, I think, is the important one that I was wanting you to kind of know the other ones, but really know this one. So this is going to be, the parts are grams per milliliter. So it's not milligrams. So milligrams per milliliter, no. But it is indeed grams per milliliter. This concentration makes up the majority of the problems involving dilutions and concentrations. So 10% solution is 10 grams per 100 milliliters. So there's 10 grams of active ingredient per drugs per 100 milliliters of product. So this is kind of goes back to the Kool-Aid example where you have the solid and you mix it with the liquid. So if 20 grams of cream contains 2.5% active ingredient, how many grams of active ingredients are in the cream? Okay, so go ahead and put it on pause and go ahead and try to do this yourself. All right, welcome back. So if 20 grams of a cream contains 2.5% active ingredient, all right, so 20 grams, oops. All right, so 20 grams is what percentage of the amount? 20 grams is actually 100, oh my Lanta. 20 grams is 100%. All right, but we know that it's 2.5% of active ingredient. We want to know how many grams. So if we set up line equals line, this is our known, this is our unknown. We cross multiply and divide. Let's see if it matches that 0.5 grams. So 2.5 times 20 grams divided by 100. That gives us, what do you know? That gives us the 0.5. All right, what would be the new percentage strength if you added 7 grams of this active ingredient? So basically it's giving you the same thing, but you're adding 7 grams now, so the total active ingredient is now going to be 7.5 grams, and we want to know what the new percentage is, because the 20 grams is still going to be the 100%, but it's not the 20 grams anymore, is it? The new amount is going to be 27 grams because you're adding the 7 grams of active ingredient. So when you cross multiply and divide, 7.5 times 100 divided by 27, that's going to give you the 27.78%. So I don't know what that is, so just ignore that. That's incorrect. So another one is a 2-liter TPN bag contains 1.2 sodium chloride. How many grams of sodium chloride are contained in this bag? All right, so set it up the same way again. So 2 liters is how many milliliters? 1 liter is 1,000 milliliters. So 2 liters is 2,000 milliliters. All right. So 2,000 milliliters is the total amount, is 100%. 1.2% of active ingredient is 1.2 times the 2,000 divided by 100. There's going to be 24 grams of sodium chloride contained in this bag. So this is going to be, which one's this going to be? Is this going to be weight to weight, volume to volume, or weight to volume? This will be the weight to volume. So this is going to be grams per milliliter, which will be 24 grams for every 2,000 milliliters. All right, so if the patient receives 175 milliliters of this TPN every hour, how many milligrams of sodium chloride will be received in 6 hours? All right, so this is kind of taking another mathematical area into just trying to figure it out. So let's think. If the patient receives 175 milliliters of this TPN every hour, how many milligrams of sodium chloride will he receive in 6 hours? So they're wanting to know how many milligrams. So if we have 24 grams for every 20,000 or for 2,000 milliliters, first we're going to want to convert this. Oh no, what'd I do? Ah. All right, first we'll want to convert this to milligrams. So 24 converting into milligrams is going to be 24,000 milligrams per 2,000 milliliters. All right. And so we can figure out how many milliliters. Let's figure out how many grams per milliliter. So if you divide those, you're going to have, there's 12 milligrams for every 1 milliliter. If the patient receives 175 milliliters every hour, how many milligrams will he receive in 6 hours? So if they receive 175 milliliters, we want to know how many milligrams that is. So 12 times the 175 divided by the 1. So that means every hour he's going to receive 2,100 milligrams of sodium chloride. Now, how many milligrams of sodium will he receive in 6 hours? Well, you just take that 21 times it by 6, and he'll receive 12,600 milligrams of sodium chloride. All right, now let's go ahead and convert that back to grams. So if we convert that back to grams, we're going to have 12.6 grams. I know that's not what the question's asking, but I just wanted you to practice with conversions. So that will be good. All right. So go ahead and try this on your own. Pause it and see if that's the answer you get. All right, and then go ahead and try this on your own and see if this is the answer you get. All right. So if you have any questions, feel free to go ahead and shoot me an email about anything. If you want more practice problems, if you want practice tests, if you want to prepare more for your pharmacy technician exam, go ahead and shoot me an email, and I will send you the information about the pharmacy technician exam. And I hope that everything goes well, and good luck.